what are the other treatment options we have? There are like internationally, if you take it, there are three good, like what we are talking about, the advanced treatment options. One is the DBS. Second is apomorphine. Apomorphine is there for almost more than 30 years. There are two types of apomorphine is available. If you look at this one, just I'll share the screen. Um, okay. Yeah. So apomorphine is there for more than 30 years. Like one is like our insulin injection. Whenever the patient is becoming off, at the time we give the apomorphine injection. Like apomorphine works in like between 10 minutes, like 10 to 30, 20 minutes. It immediately brings the patient to on. The next one is apomorphine continuous infusion. Like the insulin syringe, but it is not available in India, but probably like within like a couple of months they will bring the insulin like injection. But at present, what we are giving the apomorphine, whatever is available in India, is just like a injection. Just we take it and put it in the subcutaneous in the skin. So if you give the apomorphine injection, within 15 minutes the patient will become on. When the disease progresses, like in from moderate to severe Parkinson's disease, even though if you take levodopa, the levodopa takes 1 hour to act, or sometimes the levodopa may not act at all. In that case, we use this apomorphine as a rescue therapy. Immediately, if you give, the patient will be on. They can go to their work. They can go to a meeting, or they can go to some family members gathering like that. But there are other options also there. This is the apomorphine infusion. We can also use the apomorphine infusion just 24 hours, just putting the small needle in the abdomen, something like that. The next thing is what we have is the levodopa infusion. Giving the levodopa infusion through the intestines, like this, it will be like this. So, but this levodopa infusion is not available in India, pretty expensive. Like at least every year it is like a 4 to 5 times the cost of the DBS, like for 50 lakhs, 60 lakhs, something like that every year. But it is still not available in India. So these are the advanced therapies available in India. But when you compare between all the three available advanced therapies like DBS, apomorphine, and intestinal levodopa, the best thing still whatever we have is the DBS. That's the best thing we have. When we start the levodopa infusion or the apomorphine pump, I showed it in this picture. When a patient is not a candidate for DBS, like the patient has some problem in the brain, he is not having some troubles, tumors in the brain, or the patient is more than 75, 80 years, or the memory problems, they have lots of hallucinations, or they have lots of other depression or severe problems, something like that. In that case only, we prefer, if surgery is, they doesn't want to do a surgery of the brain, in that case only we prefer to do a alternative, the levodopa infusion or apomorphine. But if you look at the, because this intestinal levodopa is out of question in India now, the only available treatment is apomorphine and DBS. When compared to apomorphine and DBS, apomorphine is a good drug actually. But if you take a long term, like 10 years of studies, most of the patients, like because apomorphine, you need to prick the skin almost daily to give the infusion, and you need to prick it in the, we cannot give it in the same place. We need to change the place like this, every place like this, mainly in the stomach or in the skin, something like that. So if you put it daily, it's a pricking and it will be like pain also is there. So most of the patient, after 4 years or 5 years, they will stop apomorphine and they will try to change to some other advanced therapies. Mostly they prefer to change to DBS. So if it is in a young patient, but in advanced therapies, like in advanced stage, we prefer to give, when a patient is not a candidate for DBS, we go for apomorphine. But if you ask me which is the best treatment I can offer for a less than 75 Parkinson's disease, or when they are good candidate, if it's going to be my family member or my father, I would prefer DBS. That's the best option we have.